Domestic violence and elder abuse are pressing issues that significantly impact many lives, and understanding these complexities is crucial for mental health professionals. This episode complements the DV and elder abuse training course by Therapy Trainings. We will discuss the dynamics of domestic violence and elder abuse, explore their impact on victims, and highlight strategies for effective intervention and support. This knowledge is essential for counselors, therapists, and mental health professionals dedicated to providing comprehensive care. In this episode, we'll explore the dynamics of domestic violence, recognize the signs and red flags, discuss the mental health impacts on survivors and their families, and share culturally sensitive approaches to support diverse populations. We'll also cover trauma-informed care strategies, legal considerations, and importantly, self-care techniques for professionals working in this challenging field. So whether you've taken the course or are just tuning in to learn more, there's valuable information ahead. Let's start by unpacking the dynamics of domestic violence. Domestic violence is not just a physical act, it's rooted in a complex web of power and control. It's about one partner exerting power over another, manipulating emotions, and instilling fear. This often manifests through physical violence, emotional abuse, economic control, or even isolation. Imagine a relationship where one partner feels trapped, constantly walking on eggshells, fearing the next outburst. This is the reality for many individuals caught in abusive relationships. Understanding these dynamics is crucial for mental health professionals. It allows us to empathize with our clients and recognize that their behavior may be influenced by fear and manipulation. A vital takeaway from our course is the importance of recognizing the red flags of domestic violence. These can include a partner who exhibits extreme jealousy, controls access to finances, or isolates their significant other from friends and family. Now, let's shift our focus to the impact of domestic violence on mental health. Survivors often experience a range of emotional and psychological effects, including depression, anxiety, PTSD, and a diminished sense of self-worth. The emotional toll can extend beyond the individual. Children exposed to domestic violence can also experience significant trauma. They may struggle with anxiety, behavioral issues, and even difficulties in forming healthy relationships later in life. This brings us to an essential aspect of our training: culturally sensitive approaches. Different cultures may have unique perspectives on family dynamics, conflict resolution, and the stigma associated with seeking help. As mental health professionals, it's vital to approach each case with cultural humility and an open mind. This means actively listening to our clients' stories and respecting their cultural backgrounds while providing appropriate support. In the course, we also delve into trauma-informed care. This approach acknowledges the widespread impact of trauma and emphasizes safety, choice, and empowerment. When working with survivors of domestic violence, it's important to create a safe space where they can share their experiences without judgment. This can involve using language that validates their feelings and experiences, ensuring they feel in control of their treatment options. Now let's talk about screening and assessment tools. Identifying domestic violence can sometimes be challenging, especially if the survivor is reluctant to disclose their situation. It's essential to use appropriate screening tools that can help facilitate conversations about safety and support. Tools like the danger assessment or the hurt, insult, threaten, scream scale can provide valuable insights into the severity of the situation. Once we have identified the presence of domestic violence, safety planning becomes crucial. S involves developing a personalized plan that outlines steps a survivor can take to ensure their safety. It may include identifying a safe place to go, having a packed bag ready, and establishing a code word with friends or family for when they need immediate help. As we continue, let's not forget the legal and ethical considerations in working with domestic violence cases. This can be a gray area for many professionals. It's essential to understand mandatory reporting laws in your jurisdiction and to navigate the delicate balance between client confidentiality and safety. Many professionals may feel uncertain about how to approach these situations. It's important to remember that while you may not have all the answers, your role is to provide support and resources. Building collaborative partnerships with community organizations can enhance your ability to help clients effectively. These partnerships can include shelters, legal aid services, and advocacy groups that specialize in supporting survivors of domestic violence. Now, let's tackle some common misconceptions surrounding domestic violence. One prevalent myth is that domestic violence only affects certain socioeconomic groups or demographics. In reality, domestic violence can occur in any community, regardless of age, race, or income level. Another misconception is that survivors should simply leave the abusive relationship if it's so harmful. While leaving may seem like a straightforward solution, it's often more complicated due to fear, financial dependency, or emotional ties to the abuser. By addressing these misconceptions, we can better support our clients and foster a more informed community. It's also vital to understand that seeking help is a process. Many survivors may not be ready to leave their situation immediately, and that's okay. Our role as mental health professionals is to provide a supportive environment, empowering them to make decisions that are best for their circumstances. As we approach the end of our discussion, I want to emphasize the importance of self-care for mental health professionals working with domestic violence cases. The emotional weight of this work can be heavy, and it's crucial to prioritize your own mental health. This might involve regular supervision, peer support groups, or engaging in activities that help you recharge. Remember, you cannot pour from an empty cup. In conclusion, we've covered a lot of ground today, from understanding the dynamics of domestic violence to exploring the impacts on mental health and the importance of culturally sensitive care. I encourage you to take this knowledge and apply it in your practice, whether you're directly working with survivors or advocating for systemic change. If you're interested in furthering your understanding, I highly recommend checking out the DV and Elder Abuse Training course offered by Therapy Trainings. Visit therapytrainings.com for more information and to explore additional courses that can enhance your skills and knowledge in this critical area. Thank you for joining me today. Remember, every conversation you have can make a difference. Let's continue to advocate for those who need our support and work towards a world free from violence.